I'm Paul Brooks, Associate Director of Patient Experience and Facilities Management for Derby Teaching Hospitals. The Friends and Family Test has become absolutely fundamental in what we do here at Derby. It's the way of listening to our patients, it's the way of listening to what they want and the changes they want. We can all assume what it's like to be a patient in a ward, and we can try and make sure that changes are made thinking what they would like, but there's nothing better than hearing from the patient and taking their views. And what we do with that is we learn from it continually, because it's fine taking Friends and Family Test information and putting it into trends data and then analysing it and dealing with staff on the wards and talking to patients, but unless you make fundamental changes with it, then we've not taken the opportunity that the FFT gives us.
Hello, I'm Debbie Edwards and I'm the liaison nurse for people with learning disabilities at the hospital, and I wanted to talk about the cards. These brilliant cards for getting views from people with learning disabilities and also their family and carers, which is really, really important. Previously, we were unable to do this because they were really quite difficult to read, but this has been such a good way to get the views of people with learning disabilities. They're able to say what's good about the hospital, what we can make better about the hospital and about their patient experience while they're here. Yesterday, somebody told me how they liked the hospital because it was big and it was bright and it was light, and I think that's fantastic. They said they didn't like it because if it had been a dark place it would have been quite frightening, but they liked it because of that. We would never have known that before. They're also really good because they can complete them themselves. They like to tick the boxes and they like to look at the smiley faces, which has been brilliant. Patients will ask me if I can write for them when they're unable to, and I can do that, getting down all the information they want to tell me, which is fantastic. So I think they're really good.
Not only is the feedback important, but the way that we get the feedback is important as well. We use lots of different methods at Derby hospitals. So we use our cards, we use texts, we've got tablet computers in key areas, but as well as the cards, we've made sure that they're accessible to everybody. So we've had our cards translated into the 10 languages most used in Derbyshire. So we've worked with our translation services to make sure that they can reach out to everybody so everybody can share their story with us. So in some areas we have got the tablet computers in such areas as A&E, and we've also got them in paediatric areas to make them a little bit more exciting and interactive.
It's really important to us here in Derby that we understand what it's like to be on the receiving end of this organisation from our patients, and the Friends and Family Test gives us that. It gives us that in a controlled way, and we've managed to ask that question in lots and lots of different ways using the guidance that's laid down by NHS England. So we've done it and made it accessible to people. We want people from all backgrounds and all disabilities to be able to give their feedback, because it's really important that we listen to people in some of those little herd in communities.
Through our feedback, they've changed the intercom system on the ward to a special button where you press that button and the people inside the ward know somebody outside is either deaf or hard of hearing. And for the car parking, they've set up a text service. So through the feedback, they've altered the systems and made it more accessible for deaf patients to access Derby Royal Hospital.
What our patients told us was that although we've got a great outpatient department, if you were dropped off at the main entrance to the hospital, it could be difficult to find because it was in another building. Our wayfinding signage throughout the hospital was quite good, but actually it was a long and convoluted route. So taking that feedback, taking that really important, dedicated feedback about the outpatients, led us down a certain path, and that path was to talk to those patients directly, see what we could do to make things easier, and that resulted in a white line being painted. Simply paint a white line between our main entrance and the entrance to this clinic. When you come into the inside of the building, make that more visible by putting a yellow line against the floor. Put signage up that was in line with what the Disability Discrimination Act said. We did all of those things, and the outcome has been that our visually impaired patients can be more independent when coming to the clinic. They find their own way here, and that's the power of patient feedback.
One of the things that we're really excited about doing at the moment is innovating with what we might call sleep or comfort packs. So we've been working on putting together a collection of things that we can provide to patients based on what they've told us about how sometimes it can be difficult to sleep in a hospital, and sometimes because the air conditioning, their mouths can get dry, there can be a lot of noise, there can be a lot of additional lighting issues. So we're putting together this pack which has got things like earplugs in it, and a lip balm and eye masks, and a little notepad that might help them either pass the time with some puzzles in it, or it might be something where they can write their notes about something they want to talk to the nurses and doctors about later. So that's something we're going to be trialling across the hospital and hopefully making that available to all of our patients.
The Friends and Family Test is probably the most important way of gathering feedback in the NHS today, and we should have been doing it for years.